Your A1C is 5.7, 6.0, or 6.3.
Your fasting blood sugar is 108, 115, or 124 milligrams DL. You feel normal.
No extreme thirst. No frequent urination. No obvious symptoms. So you think maybe it's not a big deal.
But this is exactly where many people miss the chance to stop type 2 diabetes before it starts.
Prediabetes means your blood sugar is higher than normal, but not yet high enough to be diagnosed as diabetes.
The dangerous part is that prediabetes is often silent. You may feel fine while insulin resistance is already building in the background. Over time,
your body may need more insulin to keep blood sugar under control. At first, the pancreas may keep up, but when it can't keep up anymore, blood sugar begins to rise.
That is when A1C, fasting glucose, and post-meal glucose become important warning numbers.
A1C is a blood test that estimates your average blood sugar over about the past 2 to 3 months.
In general, an A1C below 5.7% is considered normal.
An A1C from 5.7 to 6.4% is considered the prediabetes range. An A1C of 6.5% or higher may suggest diabetes, but diagnosis should be confirmed by a healthcare professional. Fasting blood glucose is another important number.
A fasting glucose below 100 milligrams per deciliter is generally considered normal.
A fasting glucose from 100 to 125 milligrams per deciliter is considered impaired fasting glucose, which falls in the prediabetes range.
A fasting glucose of 126 milligrams per deciliter
or higher may suggest diabetes if confirmed with repeat testing.
There is also the oral glucose tolerance test. This test checks how your body handles glucose after drinking a measured glucose solution. A 2-hour result
from 140 to 199 milligrams per deciliter is considered prediabetes. A 2-hour result of 200 milligrams per deciliter or higher may suggest diabetes.
The key point is this:
prediabetes is not almost nothing. It is a metabolic warning sign. It means your body is already having difficulty controlling blood sugar.
And it often travels with other risks, such as high blood pressure,
belly fat, fatty liver, abnormal cholesterol, high triglycerides, low HDL, and family history of diabetes.
This cluster matters because prediabetes is not only about diabetes. It is also connected to higher risk of heart disease and stroke.
Now let's talk about the numbers people usually worry about.
If your A1C is 5.7, that is the beginning of the prediabetes range.
It does not mean panic, but it does mean you should pay attention. If your A1C is around 6.0, your risk is higher than someone with normal A1C.
This is the point where lifestyle changes become much more important.
If your A1C is 6.3 or 6.4, you are close to the diabetes threshold.
This is not the time to ignore the report.
It is the time to talk with your doctor about confirmation testing, lifestyle intervention, weight, diet, activity, and follow-up.
But A1C is not perfect. Some conditions can make A1C less accurate, including certain anemias, kidney disease, liver disease, recent blood loss, pregnancy, and some blood disorders.
That is why A1C should not be interpreted alone. Doctors may combine A1C with fasting glucose, post-meal glucose, oral glucose tolerance testing, symptoms, medications, and medical history. Now let's look at the 6 warning patterns that may suggest your blood sugar risk deserves attention. First, A1C repeatedly in the 5.7 to 6.4% range.
One result may need confirmation, but repeated results in this range suggest a real pattern. Second, fasting blood sugar repeatedly between 100 and 125 milligrams per deciliter.
If your morning glucose is often high even before eating, your body may be struggling with overnight glucose regulation and insulin resistance.
Third, post-meal blood sugar spikes.
Some people have normal fasting glucose, but high after-meal readings.
This can happen early in insulin resistance.
If your glucose rises sharply after meals and stays high longer than expected, that pattern is worth discussing with your healthcare professional.
Fourth, prediabetes numbers plus belly fat or weight gain. Excess abdominal fat is strongly connected with insulin resistance. Waist size and body composition can matter as much as weight alone. Fifth, prediabetes numbers plus high blood pressure or abnormal cholesterol. This combination suggests broader metabolic risk. Blood sugar, blood pressure, triglycerides,
HDL, and liver fat often move together. Sixth, family history or previous gestational diabetes.
If a parent or sibling has type 2 diabetes, your risk is higher.
If you had gestational diabetes during pregnancy, your future risk of type 2 diabetes is also higher.
This is where AI-assisted analysis can become useful.
Not as a doctor, not as a diagnosis machine,
but as a pattern organizer. AI can help you collect your A1C results,
fasting glucose readings, post-meal glucose readings, weight trend, waist measurement, blood pressure, cholesterol, sleep activity, diet patterns, and family history. Then AI can help turn scattered data into a clearer risk summary.
For example, AI can help you notice, my A1C increased from 5.7 to 6.1 over 1 year.
My fasting glucose is often above 110. My post-meal glucose spikes after rice, bread, soda, or desserts. My blood pressure and triglycerides are also high.
My family history increases my risk.
This kind of pattern is more useful than one isolated number. AI can also help create a doctor visit checklist.
You can ask,
am I in the prediabetes range? Should I repeat my A1C or fasting glucose? Do I need an oral glucose tolerance test? How often should I monitor my blood sugar? Should I check cholesterol, kidney function, liver enzymes, or urine albumin?
Do I have signs of metabolic syndrome?
What weight, diet, and exercise goals are realistic for me?
Do I need medication, or should I start with lifestyle changes?
What should I recheck in 3 to 6 months? AI can also help build a simple blood sugar log. For example,
morning fasting glucose,
2-hour after meal glucose,
meal notes,
exercise,
sleep,
stress, weight trend,
blood pressure.
But AI should not tell you that you definitely have diabetes.
AI should not prescribe medication. AI should not tell you to stop medication.
And AI should not replace professional medical evaluation.
The most important part of prediabetes is that it is a warning sign with an opportunity.
Large prevention research has shown that lifestyle changes can significantly reduce the risk of developing type 2 diabetes.
The most powerful changes are usually simple, but not always easy.
Losing excess weight if needed,
increasing physical activity, reducing sugary drinks and refined carbohydrates,
eating more fiber-rich foods,
improving sleep,
managing stress, treating blood pressure and cholesterol when needed, and following up with your doctor instead of ignoring the numbers.
You do not need to be perfect, but you do need a plan.
If your A1C is 5.7 to 6.4, do not panic,
but do not dismiss it.
If your fasting glucose is repeatedly above 100, do not ignore the trend. If your numbers are getting worse year by year, that is your signal to act earlier. Prediabetes is not a final diagnosis of diabetes.
It is a warning light.
And warning lights are useful only if you respond to them. To summarize,
A1C from 5.7 to 6.4% is the prediabetes range.
Fasting glucose from 100 to 125 milligrams per DLEL is also in the prediabetes range. Post-meal glucose spikes may reveal early blood sugar problems.
Risk becomes more concerning when blood sugar changes appear with belly fat, high blood pressure,
abnormal cholesterol, fatty liver, family history, or previous gestational diabetes. AI can help organize your numbers, find patterns, and prepare better questions for your doctor.
But doctors diagnose and treat disease. If this video helped you understand A1C, fasting glucose, and prediabetes warning patterns,
please like this video and subscribe for more evidence-based AI health education. Comment below, what should we explain next? Fatty liver on a health report, acid reflux red flags, insomnia, high triglycerides, kidney function, or abnormal blood test results.
Your comment may become the topic of our next video.